comorbidities. So kung ikaw, young individual, meron ka ng COVID-19 vaccination, hindi mo na siguro kailangan ng another one. So we will watch this kasi meron ding reports in the science journals na baka parang flu siya. We may have to keep giving it because the virus mutates. But in the meantime, hindi pa tayo certain dyan. But there's no budget for COVID-19 vaccine. I think what I will emphasize sa public is hindi vaccine ang solusyon. We learned the solution. It's minimum public health standards. Again, managing your own personal risk. So ito yung na-change the narrative, no? During the pandemic, the government tried to protect everyone, blanket. Now, it's back to individual-based risk management. Ano ibig sabihin nun? Kung ikaw high risk, ay ba't ka pupunta sa risky behavior? Ba't ka pupunta sa ospital at walang mask, di ba? Hindi mo gagawin yan. Di ba? Kung ikaw merong ubo, sipon, ba't ka pupunta sa party? Huwag kang pumunta sa party. Huwag kang pumunta sa school. So yun yung approach ngayon ng Department of Health, individual risk. Kung ano ang mga risks mo, yun ang bantayan mo. And each person, iba-iba ang kanyang risk. Ganon. So yun ang ating approach dyan sa vaccines.
Thank you very much, Secretary Herbosa and Ma'am Dec Villanueva. That also answers the question of Ms. Giselle Ombay of GMA News Online. Moving on to our next question from Mr. John Gardner of Daily Tribune, who is joining us online. So I'd like to read his question. Senator Joel Villanueva filed a resolution seeking an inquiry about the country's preparedness amid reported global increase in cases of respiratory disease. May we have your thoughts on this, Sec?
Okay, so yung ating epidemiology bureau, meron tayong epidemiology bureau, meron din tayong epidemiology surveillance units sa region, sa local government, sa city, sa barangay. Ang mga common diseases na minomonitor nito, yung tinatawag naming group of illnesses. Hindi to isang illness it's a group of illnesses. We call it influenza-like illness. So lahat ng sakit na may lagnat, ubo, sipon, iba-ibang virus ang pwede mag-cause niyan. Isa na ang COVID-19 dyan. So minomonitor namin yung what are called ILI or influenza-like illness in the community. Pinare-report yan, mandatory reporting yan. As of December 2, 2023, a total of 193,148 influenza-like illnesses have been reported nationally. This is 33% higher compared to the same period of last year of 22. So tumaas. And I think the explanation, alam nyo na, mas madami na ang society or people moving around and intermingling. So tataas talaga ang respiratory illness. Despite reporting a higher number of cases for this, ang fatalities natin, yung namamatay, lower siya. We reported only 271 deaths for this year compared to 485 reported in the same period last year. So ano ibig sabihin nun? Mas maraming nagre-recover. So ILI are mostly self-limiting and people usually recover. Lalo na kung viral, no? And then pag 2023 trends in the recent 3 to 4 weeks, October 29 to November 11, there were 11% lower to the reported cases 2 weeks prior. So ano yan siya? Cycle siya up and down depending on the number of incidents. COVID-19 on the other hand, on December 11, 2023, our total COVID-19 beds and utilization remain low at 16% ng COVID beds and 14% of ICU utilization. While these rates are low, nakakita kami ng slow increase of COVID-19 cases this month, and this is accompanied by slight increase in severe and critical ICU admissions. Pero I suppose many had stayed home. No? Even our president was tested positive and stayed home for 5 days. However, these small increases are well below the cases and the admissions during the first 3 quarters of the year. So yung mortality o namamatay, konti rin. It remains low. We only report about 1 death a day. So malamang ito yung may comorbidity at may high risk since August. So So mababa ito. Kasi the year before, 2 to 3 deaths ang nare-report na cumulative death. So ang current case fatality rate sa COVID-19, mababa na po, 0.33. Naalala nyo, umabot ito ng mga 5 ba? O 2, basta mataas to nung height of the Delta and the other cases. So nationally, our cases are also increasing ng COVID. So we reported 1,821 cases from December 5 to December 11. Weekly na kasi ang bilang natin, hindi na daily. Averaging namin mga 260 cases per day. A little bit higher yan than the dating 190 lang in the previous week. So tumaas talaga pero very slight from 191 to 260 cases a day. So we hope with this press release maging careful ang mga tao natin about this. So very important reminder, hygienic practices pa rin to, cough etiquette. Cover your mouth and nose if you're going to sneeze or cough. Wash your hands. Go to parties na outdoor. Kung ikaw ay high risk, tingnan mo kung saan ang venue. Kung sa garden or sa outdoor, baka safe ka doon. Pero kung enclosed space, kagaya nito, tapos meron kang mga comorbidity, baka you should wear a mask or iwasan mo na lang yung party or stay for less than an hour. Magbati ka lang sa friends. We're also recommending for our elderly, meron tayong available influenza vaccines and pneumococcal vaccines available for the elderly. Although hindi i-stop yung illness, pero ang symptoms mo magiging milder. So we continue to monitor ang situation natin sa COVID.
Thank you very much, Secretary Herbosa. Moving on to our next question, may I call on Ms. Ara Perez from CBN.
Hello po, sir. Good morning. Sir, hi sir. Sir, nabanggit niyo yung mga nagsasharon kapag mga Christmas party. So yung question ko pa is related to that. How many times can we reheat food na tinake out natin sa anywhere? Tapos, paano natin malalaman kung spoiled na yung food? Gaano siya katagal dapat sa ref lang or freezer? And then ilang beses pwedeng i-reheat yung food na safe? Thank you po.
So my first answer to the question is on reheating. Actually, it's not on the reheating, it's the handling of the food. So pag yan nahawakan, di ba, if you know, we have serving spoons. Pero pag nahawakan yan, the chances of it being contaminated by bacteria becomes higher. So even if you reheat it, mataas yung bacterial content, magkaka-food poisoning ka. So it's really the handling of the food. Then the second is tama ka, the storage and the time. So if you handle the food and you keep it and stored talaga in the freezer, your chances are lower. But of course, iba-iba din yung time niyan. There are foods that will stay longer frozen and then you just defrost and then reheat. Pwede pang kainin. So how do you identify? Common sense. Amuyin nyo. If it smells bad, huwag nyo ipilit lutuin. Throw it in the waste can. If it doesn't look good, may tumubong something, throw it also in the waste can. So do not sacrifice yung health nyo. Mauuwi kayo sa emergency department at mabubutas ang bulsa nyo. Mahal magkasakit.
Number of reheating. Number of times,
It's
wala.
not the exact number. You can reheat food as many times. It is really the way you've handled the food. Na-store mo ba siya properly? Or anong tawag dito? Kung exposed siya to the air, like yung handa na yan, naka-expose siya to the air for several hours, that means tumutubo na yung bacteria dyan. Yun yung problem. So even if you reheat it, if that was standing there, the food was standing there at noontime, tapos dinner pa kayo magpa-party, pag sinaron mo yon, yung bacteria nun, naging culture medium na yon. So kahit i-freezer mo yon, freeze mo lang, at that time, marami na siyang bacteria. So pag nilabas mo, nireheat mo, yun na naman, meron ka rin contamination of bacteria. So that's how the microbes grow. It's really about so there's nothing like preparing your food fresh and then lutuin mo and then kainin mo kaagad. Correct. So it's the food handling. Food safety is all about proper food handling. And then make sure kung nagsasol siya well, yung handling with human hands already increases the amount of bacteria in it. Pati yung ginamit mong serving spoon. Baka sinerving spoon nga pero tinikman nung isa, pinasok niya sa mouth niya. Meron din bacteria yun. Pag binalik yung serving spoon doon, kinontaminate mo na yun. Maya-maya, dadami na yun after several.
Thank you very much, Sected and Ms. Aya, for raising that question that also answers the question of Ms. Zaki Espina of Manila Bulletin. For our next question, may I call on Ms. Dirk Villanueva from the Philippine Star.
Secretary, another question po. I would just like to ask what happened to the Nursing Advisory Council and what has it achieved so far?
Okay, so na-create, as you very well know, I created the Technical Advisory Group of Nursing Experts, no, or TAG-NE. This was formed through a department order, Personal Order 2023-6846. And ang idea ko dito is yung mga issues natin sa karapatan at mga karapatan ng mga ating health workers and mga recommendations nila sa department mapag-usapan. So they've actually met, I think, twice. Nakausap ko sila. I think they've met twice. And they are now putting their agenda na prioritize na nila kanilang pag-uusapan. And ito yung some of the things. How to have a committed, equitable distribution of the nursing workforces that with fair compensation and opportunities. So mag-a-align dyan dun sa ating National Human Resources Health Master Plan. Ang isang siguro pwede kong maikwento sa inyo, I attended the meeting of the World Health Organization regional meeting dito sa Manila a few months ago. And yung head ng Human Resources for Health ng WHO, challenge ako to lead a meeting to discuss the global human resources for health at tinanggap ko. And we're now organizing a meeting in May, just before the World Health Assembly, so that I can talk to the ministers of health and present a new way to approach the need for global human resources for health. Di ba ang problema, in the past, ang ginagawa nila, ethical guidelines. Huwag niyong kunan ng mga health workers, yung mga low and middle income countries kasi nagsasuffer. Sabi ko, hindi naman mag-work yan kasi that always creates mali ka, tama ka. So ang approach namin ngayon is a global collaboration, yun ang ipipresent ko sa kanila, na alam namin kailangan nyo rin ng health workers. Alam nyo, gustong-gusto na nyo ang mga Filipina nurses kasi sila yung magagaling. But let's talk about this in a equitable way na pwede nating mas ilan ba talaga kailangan nyo, baka pwedeng exchange requirements. So ganun yung approach. It's now going to be, how do we supply the world with the best Filipina nurses? So we become part of the solution than being part of a problem. So babaguhin namin yung narrative. I'm happy the WHO asked me to lead this kasi we're one of the nations that really are of high demand. Even the president told me when he appointed me as Secretary of Health, sabi niya, alam mo, Dr. Herbosa, every world leader that talks to me, ang first introduction, can you give me nurses? Can you give me Filipina nurses? Yung ambassador ng Canada, kausap ko in a dialogue, I said, why don't you just send the young Canadians and give them scholarship in our nursing schools? Kikita pa yung nursing schools. Tapos kunin nyo back. Sabi niya sa akin, Secretary Herbosa, we don't want Canadian nurses. We want Filipina nurses. So mukhang yung product natin maganda talaga and magaling talaga. I think the aruga of the Filipina woman is really what's felt. So talagang in demand tayo. So ako, sige, we'll produce more. If you have a good product, di ba? If you're making a car and it's being bought by all countries, di ba i-increase mo yung production? So ganun na rin ang concept ko. I'm not gonna stop them from hiring Filipina nurses. They're paying them well. I'm gonna produce more. But where will I get the funds? So yun yung plano ko. So kukuha kayo ng nurses sa akin, mayaman kayo. Magbigay kayong scholarship sa mga batang Filipino and I'll put them to nursing. So mas madaming magkaka-opportunity to get college and education. So yun yung base now. The other things I'd like to do is, iutos ko rin sa TAG is to provide housing. And nakausap ko na ang DSUD about this. We have some land sa Department of Health, we can use it for PPP wherein pag-ibig loan and the nurse employee can start to contribute. By the time after several years, kanya na yon, yung unit na yon. Baka less ang chance mag-abroad pag meron kang unit na may bahay ka na, may family ka na, the chances are they will stay and work in the Philippines. So we're fighting high salaries with other benefits for our health workers.
Ma'am Beck, I believe you have
Hello.
another question.
Secretary, yung as to COVID-19 allowances, how much has been paid the health workers and magkano pa po talaga yung kulang?
Okay.
And what is our promise to the health workers that who are continuously protesting and saying that hindi pa nila na-receive ang kanilang allowances?
Okay, for the health allowance, we've allocate, ang kailangan nating total is about 60 plus billion pesos to pay for the health workers arrears since 2021. We've paid a sizable amount, if I'm not mistaken, around 14 billion na. And then itong for this year, nakapag-release ang DBM ng 4 billion. And ang distribution nun, parang na-distribute na rin mostly on about 90+% have been disbursed or paid to the individual health workers. Pero I admit, marami pang nurses and health workers na hindi nababayad yung health emergency allowance. It's in the GAA. We have 19 billion this year and another 22 billion next year. But it's placed under unprogrammed funds. Unprogrammed funds means depende sa perang ma-accumulate natin. If we have more taxes and the economy is better, the unprogrammed funds can be funded. So yun ang sitwasyon. So I've requested for the next 4 billion na pwedeng i-release ng BM. I just hope ma-allocate yan para makapag-distribute uli ako this Christmas. Pero of course, hindi pa lahat. So we'll have to wait for this until the government has money. Parang ano yan pamilya mo may hinihingi yung mga anak mo. Yung kita mo, ganito lang So syempre, gusto mong ibigay yon pero pag may pera ka, ibibigay mo talaga yun. So hintay na lang sana yung ating mga healthcare workers for the health emergency allowance.
Thank you very much, Secretary Herbosa and Ma'am Beck Villanueva.
Thank you, sir.
The next question will be coming from Ms. Ara Cruz of ABS-CBN.
Hello, Sec. Sa measles naman po, may update po ba tayo sa cases and are these alarming or okay pa naman po? Thank you.
Okay. For measles and rubella, parang ito yung ating preventable diseases and as you know, ito yung ating nasa National Immunization Program. Binabakunahan natin lahat ng bata against this. Mabilis kasi kumalat ang measles. And we give this to children under 5, no? So yan ang first step dyan. Kailangan mabakunahan lahat. In fact, yan ang isa sa aking mga strategic goals na to reach the fully immunized child na 95%. Mawala yung zero-dose children. As of November 25, a total of 2,594 measles and rubella cases were reported. So among this, 337 or 13% were laboratory confirmed, 97 or 4% were laboratory confirmed rubella. So dalawa yung diseases, no. While the remaining hindi sila laboratory confirmed but clinically compatible. So yung tinatawag namin clinically diagnosed. So there is a slow uptrend of cases in the past 3 to 4 weeks, October 29 up to November 11, about 6% increase. So 245 cases reported in comparison to only 230. So konting-konti lang 2 weeks ago. Additionally, a total of 444 cases were reported in the recent 4 weeks. So ito yung mga region na tinatamaan ng pag-increase. Region 1, Region 4A, Region 9. So ito yung may continuous increase and I do hope the regions will look into this. In the recent 6-week period yan naman tumataas. NCR, Region 3, Region 5, Region 6, Region 12 and BARM, Region 5, Region 11, Region 12 and BARM showed case increases in the recent 3 to 4 weeks, reporting anywhere from 2 to 253 cases. So, yan ang ating sitwasyon. Ang measles nakakamatay din because yung measles self-limiting, they usually recover. But because the immune system of the kid is mababa, napapasukan sila ng bacterial pneumonia. Again, this is a respiratory illness. Doon sila namamatay, yung bronchopneumonia, which is usually bacterial. So ano yan, opportunistic. Dahil nagka-measles sila, mahina yung katawan, tapos dadapuan sila ng second illness. Ito yung namamatay na ICU. So very important. Preventable po ang measles. So maganda, all mothers mapabakunahan yung mga anak nila under 6. Last summer, nag-umpisa tayo ng supplemental immunization activity. Nag-vaccinate tayo ng lahat ng under 5 ng measles and rubella. And I hope nakatulong din yon sa hindi masyadong pagdami.
Thank you very much, Secretary Ted and Ms. Ara Perez. Going on to our next question, will be coming from Mr. John Garner of Daily Tribune.
I said John from Tribune po.
Yes.
Sir, the Senate just ratified the reconciled version of the 2024 General Appropriations Bill po. It was mentioned na nabawasan po yung funding ng PhilHealth around 40 billion if I'm not mistaken, and we would just like to know kung ano po yung comment nyo dito, and how do you think it would affect the services and programs being implemented by the PhilHealth? Thank you po.
Okay. Siguro I cannot verify that, pero I also heard that. Nadinig ko rin na na-cut yung requested budget of PhilHealth by 40 billion. Pero nag-increase yung DOH budget by 50 billion. Yun naman ang masasabi ko. So parang nilipat lang to direct services. And ang masasabi ko dito, PhilHealth is a very robust corporation. It's got reserves that are very high. In fact, if you've heard, the reserves are something like about 400 billion yung kanilang invested money. So hindi masyadong ma-affect yung services ng PhilHealth or financing ng members diyan. And I think when it was transferred to our malasakit medical assistance for indigent patients, which actually pays for hospitalization. So parang nilipat siguro nila. Baka the legislators feel mabagal magbayad PhilHealth, dito na lang natin ilagay para pag nag-request ka, bayad agad ang hospitalization niyo. So I'm thinking, I hope that's the logic they did that. So I think that should benefit our people more. If yung tinitanong mo sa akin, PhilHealth kung magbigay ration lang 20,000, 30,000. Pero kung dito sa MAIP, kung ano yung ni-request, at yun ang kailangan bayaran, nababayaran sometimes all of it or a big portion of it. So baka that's the wisdom of transferring it to Department of Health.
Thank you very much, Secretary Herbosa and Mr. John Garner. Next question will be coming from Mr. Mon Galvez of SMNI.
From TV5.
Five.
Apologies from TV5.
Good morning. Mon Galvez po from TV5. Sir, clarification lang po doon sa binabanggit nyo kanina regarding sa hospital utilization for COVID cases. Is there percentage po ba na ibinaba po talaga na number of units for hospital na 10% na lang yung allocation na lang for COVID, just for us to have a figure on that or an idea? And aside from the 3 hospitals po na nabanggit na dumami yung cases po, how about other regions or other parts po ng bansa? Meron din po ba mga hospitals na or areas na tumaas po talaga yung bilang?
So for the first question, Simon. For the first question, Mon, tama ka. The EB, the Epidemiology Bureau, monitors based on the denominator, which is the COVID beds, di ba? Kasi hindi naman total beds of the hospital, it's the COVID beds. And ang maganda doon, hindi doon lang sa 3 napupuno, doon sa others hindi. So that means hindi pa talaga siya, low pa rin ang utilization as the numbers show. And ang maganda dito, Mon, we can do what is called surge. So kung mas maraming COVID, kinakain niya yung ibang beds. So we can increase the number of beds up to, in the government, naalala nyo, up to 80 to 90% ginawang COVID beds. Tapos sa private, up to 30. pina-increase natin from 10 to up to 30%. So parang elastic yan. We can actually move it. So no fear. We've learned how to adapt yun sa surges na yan. So kung magkaroon outbreak na or increasing cases in the next few weeks, we will just increase the capacity for admitting those. The good thing is, marami nung cases sa bahay lang. So maraming cases hindi na na-hospitalize unlike before yung previous. So yun yung happy kami. You go to the hospital, COVID ka. Pag hindi ka for admission, sasabihin sa'yo, sa bahay ka lang. So yun yung, alam na ng doctors how to manage yung for hospitalization and for yung second, sa ibang region, ganun din, we're monitoring the regions, hindi naman tumataas yung region. Sa NCR yung meron tayong cases. So, ano lang, same warning to all the regions. So, tumataas naalala niyo yung COVID, tumaas sa NCR, tapos sa Cebu dumami, tapos sa Davao dumami. Sumusunod-sunod eh. Hindi siya simultaneous, puputok lahat eh. Kasi as people move around, doon nagmo-move din yung virus. So kung tumataas sa NCR, tapos nag-uwian tayo sa probinsya by the time of Christmas, so baka may baon na rin COVID doon at makakita tayo ng cases na pag-uptick doon. So that's why we would tell people to be careful. Alam na natin to. The nice thing is, hindi na siya dapat cause ng stress or trauma because we already learned what we learned in the pandemic. So gamitin na lang natin at i-practice natin. The best is social distancing, hand washing, face mask, the things we learned in kindergarten, gamitin natin.
Thank you very much, Secretary Herbosa and Mr. Mon Galvez of T5. Next question will be coming from Ma'am Margaret Gonzalez of SMNI.
Hi, sir. Good
Hi.
morning. Merry Christmas in advance. Sir, lumalabas doon sa survey ng FNRI na parang pataas yung trend doon sa mga kabataan 10 years old to 19 years old na dumadami sa age group na yon, yung nagiging obese and overweight. Ngayon po ang sabi nila, yung panawagan nila is magamit yung datos para sa magandang programa, para po sa magandang intervention. Ano po kayong magiging action plan ng Department of Health?
Oh, I'm glad you mentioned that kasi nakatutok ako sa undernutrition, And true. And the pediatricians have been telling me na nagkakaroon tayo ng problem of obesity in children. Mabigat yan, Kasi if you have children that are obese, they end up having hypertension at an earlier age. They end up having heart disease at an earlier age. So madali naman ang solution sa obesity than the undernutrition. Kasi yung walang makain, mahirap talaga. Sa obesity, sasabihan mo lang yung mga parents, huwag niyo masyadong pakainin ng mga ma-foods yung bata. Huwag masyadong maraming matatamis, maalat at matataba. So, number 2, pa-exercise nyo naman yung bata. Let them go outside and play. Most of our kids become obese because they like playing the computer games. They like the gadgets, and then they like watching movies on so nakaupo lang. So gawan ng activities ang ating mga kabataan, that age group. They should be going around, and this is where communities can help. Local chief executives can build nice parks and playgrounds and basketball courts and football fields para these kids will go there and play. Nung bata, yun ang ginagawa ko lang eh. Pag sikat ng araw, naglalaro na ako kasama ng mga barkada. We hope mangyari uli yun na kids are active. If they're young, they make them active and move around. But the community has to build. So yan yung whole of society sa 8-point action agenda. Mag-build tayo ng places to play. Otherwise, uupo lang sa bahay yan, mas interesting sa kanya yung computer game. So we've got to make places for interest to have physical activity. Thank you.
Thank you very much, Secretary Ted and Ms. Margaret Gonzalez. Next question will be Gerard Naval from Malaya Business Insight.
Sir, good afternoon. Ay, good morning, sir. Good morning, sir. Sir, yung question ko lang, sir, yung sa Firecracker ban. Yung previous administration po kasi was very firm on its belief din sa ban. May I ask po, anong position ng current DOH with regards dun sa Firecracker ban with the forthcoming New Year celebration?
Hindi pa natin nililift yung ban, The ban still goes, meron tayong Executive Order 28, Series 2017, panahon ni Duterte. This is still in effect kasi hindi naman ni-reverse eh. So this executive order is in effect. Ano ba nakasulat dito? Ang title nito, Providing for the Regulation and Control of the Use of Firecrackers and Other Pyrotechnic Devices. It's prohibitions, may mga pagbabawal, and it's not a total ban. So, ganun pa rin. I think iikot ako and I'll go to the hospitals. I know the stories of the injured kasi that's my work. I'm an emergency physician so trauma surgeon ako. Nakikita ko sila, mga eye injuries, mga poisoning, ano pa ba yun? Yung naputukan sa daliri, yung talagang gumagamit ng band na malakas kasi yung mga bata gusto nila mas malakas. Pero pag nagkaroon ng bulilyaso, tanggal ang daliri nila. So we continue to advise people. It's better mag-celebrate tayo, magturotot na lang tayo, iwasan ng paputok.
Thank you very much. Moving on to our next question will be coming from Mr. Mark Patalco of PTV4.
Good morning po, Sec. I'm Mark Fatarco from PTV4. In terms of preparedness, ano po yung mga nakahandang contingency plans in place for potential future surges of COVID-19? Nabanggit po kanina, pwede po tayong mag-increase ng COVID-19 beds in the hospitals. Ano pa po yung iba, sir? Thank you.
So basically, ang umpisa dito is risk communication. Ang natutunan ko sa epidemics and outbreaks, sometimes the misinformation or the rumors spread faster than the virus. So very important ang partnership natin, the media, and the communications, that we release the correct information para hindi magpanik ang tao. We release information to them kung anong gagawin in case magka-COVID sila, saan sila magpapatest. We make it available. And we also prepare for other things. We prepare for resources na kailangan. Ito yung hospitals now, i-warn na natin. Siguro magmamandatory na rin yung ibang hospital na mag-face mask ang mga taong bibisita doon. So, babalik tayo, magbabaon ka ng face mask kung dadalaw ka sa kamag-anak mo sa ospital. Kasi baka implement na nila yung mandatory face mask wearing inside the hospital. Sayo, hindi pa tayo magmamandate sa public transport, sa mall. Mababa pa rin yung cases. So ito yung mga preparations. And then the surge capacity of the medicines. Nagpe-prepare na ako with FDA to try to get more available medicines. We also hopefully will get some of the vaccines na sinasabi ko kanina, XBB. So ang preparations include logistics and preparations. Meron tayong head ng director ng Health Emergency Management Bureau, and every hospital meron din yan. So i-re-implement natin yung ating emergency plans the same way as parang early warning ito yung dumadami yung cases. So the same way as pag may bagyo, may typhoon signal, the hospitals start to prepare. Ganun din to. There's increasing cases of COVID. Hospitals are going to be asked to prepare. Hindi na natin ginagamit yung alert level kasi wala ng public health emergency. Ang ano lang dito is whether there is an outbreak or not. Yes or no lang to. Is it going to be an outbreak level? An outbreak level is a level wherein it's almost double the previous time of the previous year. So until it's the same or very little, wala pa tayong outbreak. But I'm saying may uptick of cases.
Thank you very much, Secretary Ted and Mr. Mark Fatalco. We are now moving on with our second to the last question coming from Mr. Ace Cruz of Balitang A to Z.
Hi sir, hi Sec. Ace from Balitang A to Z. Sec, tanong ka lang, although sinabi mo hindi naman mandatory or babalik yung mask rule, mask on sa public transportation, establishments, pero sa simbang gabi, would you suggest yung mga sausaw ng holy water, tatanggalin ba, or alam mo, pag-iingat lang sa uptick ng COVID, sa iba pang sakit, tsaka yung capacity kaya medyo mabawasan na ba?
So, ano ang difference in a public health emergency than in the normal times? In normal times, I expect each individual to do their own risk assessment and risk management. So, ibig sabihin nun, kung ikaw high risk, may mahina ang immune system mo, huwag mo nang i-dip yung kamay mo doon sa holy water. Baka ma-infect ka pa, di ba? Kasi madaming tao nagdidip lang. Pero kung ikaw healthy, wala kang problema, vaccinated, I think you are safer to do the normal practices that you actually do. So, health literacy ang tinuturo ko ngayon. I'm changing the narrative. Wag fear. Be literate. Know the things that will cause you to become infected. Kung alam mo to, your actions will be correct. Kung uubo ka, sisinga ka, lumayo ka sa ibang tao, mag-cover ka ng nose and mouth mo to protect them and to protect yourself, di ba? Wash your hands frequently. So whether it's sa simbang gabi or not, or in the mall or shopping, if you practice those principles, hindi tayo magkakalat ng mikrobyo, any kind of microbe, hindi lang po COVID-19 all. Kasi yung minimum public health standards, generic naman yon sa lahat ng mikrobyo and infectious diseases.
Thank you very much, Sec Ted and Mr. Ace Cruz. For the last question, may call on Mr. Red Mendoza of Manila Times.
Hi, Sec. Good afternoon po. Long time no hear. I have two questions po. First, nasabi niyo po sa CA hearing ninyo na you're supportive of medical marijuana. So, of course, the bills in House of Representatives are still languishing in the committee level. So, ano po yung magiging ways natin to push for medical marijuana na, of course, meron pa ring mga sabi nga, meron pa ring mga inhibitions sa ilang mga side sectors ito. And secondly, of course, napag-usapan na rin po ito kasi may mga hearings po about the excess deaths of COVID-19 during the congressional hearings. May iba po parang tinuturo pa rin po nila yung vaccines. Yes, kasi the hearing conducted by Kong Dan Fernandez, parang they invited experts with questionable integrity, lalo na yung mga nagpo-promote ng ivermectin. So, sa DOH po ba, paano niyo po ma-resolve itong mga issues na ito? Kasi hanggang ngayon parang nandito pa rin yung fear ng tao sa bakuna. Kahit wala na tayong bakuna, pero andun pa rin, nag-heighten pa rin yung fear ng tao sa bakuna ng COVID-19, even if tapos na yung vaccination exercise natin.
So two very interesting questions, medical marijuana and excess deaths. On medical marijuana, my personal position, and I guess now the Department of Health's position, is that we are supportive of bills that will legalize medical use or medical indication of marijuana. And ito yung finished product na to. These are either inhaled substances or oils that you use, manufactured na siya, coming from marijuana or cannabis oil. So, ano yan, madami ng indication siya for cancer pain, glaucoma, several other indications, and may scientific basis na yan. Right now, merong nakakapasok niyan through what is called compassionate use permit, compassionate special permit. So, pwedeng ipasok yan for patients with cancer na kailangan siya. Pero mahirap at mabusisi. Kaya sinusupport ko yung medical use, law legalizing medical use of marijuana. But I'm not supporting the recreational use of marijuana, which means hindi yun pareho. And ganon, I'm also not supporting cultivation of marijuana kasi in the Dangerous Drugs Board, listed dyan as a banned or outlawed products. Yung excess deaths, that's a very interesting discussion because yung excess deaths, hindi dati binibilang yan. That is a very new indicator that some scientists started to look at. And there are still no fixed ideas of where the excess death comes from. Some people, of course, the anti-vaxxers are relating it to the vaccination. It's very easy to relate it kasi ang dami natin binakunaan eh. So pag dumami ang madali ituro siya. Pero so it can be related but hindi siya cause and effect. Hindi siya causative. Mas thinking namin, ganito yan eh. The way I look at it, di ba, disaster medicine ang linya ko. Pag nagkaroon tayo ng bagyo, or lindol, madaming nai-injure. Lahat sila, ang mga injury nila, buto, di ba? Or burns, pagka-volcanic eruption. So, marami kang injuries na ginagamot. What happens is nababurden ng health system treating one particular illness. So, nagkakaroon ng deaths in the other illnesses. yung atake sa puso. Minsan delivery lang eh. Hindi nadala sa cesarean section dahil may bagyo. So during a mass casualty incident, nafo-focus specific to certain conditions. And I'm thinking, yung excess deaths na yan happen in times of big emergencies. Meron tayong excess deaths. That's why during the pandemic, tumaas yung excess deaths. That's my scientific explanation of excess deaths. Is it related to the mRNA vaccine? I don't know. It doesn't seem like. Kasi na-injectionan din naman ako ng mRNA. Dito, pag nag-survey ako sa inyo ng na-injectionan ng mRNA, siguro naman wala kayong narinig na namatay. So, but we monitor this. Yes, there are people that died after vaccination and there are people that died months after vaccination. Yung namatay months after, ang hirap i-relate kung talagang namatay sila dahil dun sa vaccine or not. So, hindi ko rin masagot yan. I had a meeting now with I had talked now with the PSA about this excess deaths. Kasi ni-report nila ng PSA. So, sabi ko next time, please consult us para we can have a deeper dive and analyze what is the cause of the excess deaths.
Thank you very much, Secretary Ted and Sir Red Mendoza. And that sums up the first part of our program and our special media forum. To officially conclude our special media forum, I ask Secretary Herbosa for his closing remarks. That will be followed by a photo opportunity with our media friends.
Thank you, Lynn. So before we conclude today's special media forum, I'd like to extend our heartfelt gratitude to our media friends for your unwavering support and dedication in collaborating with the Department of Health. Indeed, you have been instrumental in disseminating vital health information to our kababayans. Your commitment to accuracy and responsibility in reporting, promoting health campaigns, and sharing accurate data has immensely contributed to raising awareness and fostering a healthy Pilipinas with health literate Filipinos. Your efforts have not just informed and empowered Filipinos to make informed decisions regarding their health and their well-being. Thank you for being our steadfast allies and partners in this journey towards the realization of a bagong Pilipinas kung saan bawat buhay mahalaga. Merry Christmas sa inyong lahat.
Maraming salamat po. Media friends, please come forward for our photo opportunity with Secretary Ted Herbosa.